Yeah, and it's predicted with the current system is in place by the year 2020, every year in between now and then, it's going to increase 5.5% in cost per year from what it is now, which is 31.1%. So if it's still increasing at that rate, we're just going to go more and more into debt if we don't do any reforms in the system that we have, like pharmaceuticals, which is monopolized, and when one company charges this amount for this drug, all the other companies look at them and they say, oh, well, they're charging that, why don't we charge that too? This is pretty much the only place that happens in. For like in another country, if a drug was made in 2001 that treats cancer, if it costs $600 on the market when it's released, it'll go down from there. But in the United States, cancer drugs have just gotten more expensive since the 2000s, and the prices aren't going down because price inflation is increasing the cost of what it would make. With this pill that costs $50 to make.
Do you think that has anything to do with the advancement in our technology that may be costing us more? Because, I mean, or do you think it's just the doctors and the insurance companies and our government just trying to make money off of it?
Well, seeing that they have all of this, they're having all of this extra, their profits have increased every year.
Yeah.
And they're making more and more money.
Yeah.
And if they were increasing their care and focusing in on trying to improve what they're doing, you would think that their profits margin would maintain relatively the same, if not go down, because they're focusing more on the care of patients instead of profits. But since the profits have been going up, I think that they're more focusing on themselves because these CEOs are millionaires.
Do you mind looking up a statistic for us on how many, if the amount of cancer in the United States has gone up or down in the past couple of years?
Mm-hmm.
Because, like what you're saying is if the numbers go up and the patients are going up as well, then that's a good thing. But if the numbers goes up and the patients go down, then that's something that's a major issue in the United States.
It says here from 2001 to 2008, 454.8 per 10,000 men and women per year had cancer-related deaths. And the mortality rate is 171.2 per 100,000 men and women per year.
Yeah.
Crazy.
That's a lot of people.
Yeah.
So that's a high number if they're making a lot of money off that. So maybe some regulations would help in our healthcare system. So
What do you guys think about like the program that was set by Obama, like that people refer to as Obamacare?
I believe that people went to pay for it, and they thought it was going to be a great thing, and the numbers went up. People had health care those first 2 years, and then you saw a major influx of people that cannot afford health care because Obamacare is so expensive, and it is unaffordable for most people that need it.
Yeah, that's true.
While Obama made a lot of money for his organization, or the ACA, because these people were in need, and they looked to him to make this Affordable Care Act, which ended up being, after the first 2 or 3 years, people could not do it anymore. And
Now we owe a lot of money, and we're in debt because of it.
Taxes, we rose a lot in debt whenever that happened. Taxes increased so much to where...
It says here that 11.4 million people are expected to re-enroll into Obamacare policies during 2017. So all of those people are getting it, but all of those people are enrolled in it, and they're resulting from it. But as far as it asks for a personal story, so as far as personal, what's affected me personally, my grandfather has Parkinson's disease, and he had to buy a $150,000 surgery for a brain implant that would help reduce his symptoms for a couple years. So he had to pay for that. He's on Medicare and Medicaid, and the way that his plan was set up, he wasn't allowed to enroll into Obamacare. So he had to pay an extra $7,000 was the money for over all of the years that he was getting care, and he was being paid for. So Medicare and Medicaid covered about over, I don't know what the exact percentage, but he still had $60,000 left over he had to pay for.
So
and
nearly
that came
probably
out of
about,
pocket.
what, 50% almost?
Yeah, they cut off that, and Obamacare actually ended up making my grandparents spend more and more money instead of actually bringing down costs because of you're not a part, you have to.
And so that's the thing. After a few years, your grandparents are probably like, "No, we're done with this," and that's kind of what we saw in statistics.
Yeah, it's just
So One more thing that we could touch on is the idea of healthcare in Canada and the way that they can walk into their hospitals for free, and the way that people in the UK can do that for free. I want to bring up the fact that I truly don't believe that anything is free. You can say you can come get this care for free, you can come check up for free and all this stuff, but in the real life, your taxes would be extremely high, because you're not only paying for yourself, you're not only paying for your family, but you're paying for people around you that can't pay taxes, the people who can't afford this, can't afford that, but they're still getting it for free because it is socialized medicine. So socialized medicine brings these people to where they all get the same equal care, which makes doctors not get a lot of money because they're not getting paid as much. So they're not going to practice as much, they're not going to practice as hard, while also there's going to be hundreds of patients waiting in the waiting room. What was the waiting time you said?
The waiting time for a broken
9 weeks?
Yeah, for a broken leg was like, I don't have the number on me, but it was around 9 weeks in between getting care.
I know,
So that's what happens when you bring in socialized medicine. All these people may be getting care, but is it really care, or is it,
It's true.
you know what I'm saying? So-
Yeah, like I know, like especially like on Post, I know you can like there's like walk-in like doctor visits
and that's
that you
paid
can
by
do.
the military,
Yeah.
and that's perfect. I mean,
Yeah.
if you can do that, then that's perfect.
But
And
like
there's some situations where if you need it and you can walk in there and you can't afford anything, so you want to go visit one of those hospitals, by all means. But
yeah.
I don't think that America's healthcare system should turn into socialized healthcare, because otherwise there would be a lot of people paying a lot of money just for something they could have paid for with not spending any of their dollars.
I feel like this is such like a issue that like has so many like factors to it that like there can't ever be like a solution to it, honestly. Like I feel like no matter what we try to do, we're always going to be putting more money in.
There's gonna be a lot of
Something taxes are going to be raised. Something is going to be like a consequence of us everyone having insurance like that.
Yeah, I agree.
Well, guys, what do you think?
I think so.
Nice.